Hi, good morning. My name is Wendy Henricks, and I'm with Alexander's Aesthetics, and welcome to one of our webinar series today. We have Michele Phelan from Concepts Institute of Advanced Aesthetics. At Alexander's Aesthetics, one of our main goals and missions and values is to provide ongoing education for estheticians. And Michele is in California and partners with the California Office for hands-on classes, but also does a lot of on-demand and webinars with us. And her knowledge is so expansive and amazing. And we really appreciate the partnership that we have together. So thank you for Michele for all of the education that you've provided us. Today in particular, we are going to be talking about what it takes to become a medical esthetician. Michele has an on-demand medical esthetician course that is posted on our website that we will share that link to. It is a paid class, but what we wanted to do is come on here and do like a Q&A style of what that actually means to be a medical esthetician and kind of some of the things you need to think about in order to do that. So Michele is doing a wonderful promotion that if you sign up for the class within 7 days, she'll add some bonus material to that and put in one of 5 free classes for you as well. So Michele will talk a little bit more about that, but I wanted to welcome everyone and say thank you, Michele, for all that you do to provide such great education to our industry. It's really important. So thank you. It is a Q&A style today. And so I'm going to be asking Michele some questions, but we also want you to ask Michele some questions. So if you could take a minute and try to just locate the chat, that would be amazing. And once you get into the chat, if you can just put in where you're calling in from, that would be awesome. And because we are recording, I'm just going to only show Michele and I's video just for privacy sake. So it's lovely to see everybody, and I wish we could see everybody, but we've gotten some comments that, we just want to make sure to preserve everyone's privacy. So go ahead and put it in the chat. We have Loveland, Colorado. We have Chicago, Illinois, Bay Area, California. Yay, that's where Michele's from. And obviously, I'm here in Colorado for the Loveland, Colorado. Anybody else? We've got a few more in. Let us know where you're from. Anyway, go ahead and throughout the presentation, go ahead and put in um, any questions that you might have in that chat. I'll monitor the chat and Michele as well, and we'll try to get to all the questions. We've set up this webinar to be an hour. Michele and I are both available for longer. So if you have a lot of questions and you're not getting your questions answered, we can stay on longer as well. So with that, I'm going to pass it off to Michele and have her give us all the information that you might need in order to think about becoming a medical esthetician. Thanks,
Okay,
Michele.
thank you, Wendy. Thank you so much. And welcome, everyone. Thanks for being here this morning. I know it's early morning on Monday. I'll just tell you a little bit about myself in case you haven't been in one of my classes in the past, and then I can tell you a little bit about the program, and then we'll open it up for questions and answers. I know, Wendy, you had some really good questions that you wanted to ask that pertain to the class and also pertain to estheticians working in a medical spa. So, my name is Michele Phelan. I've been in this industry since probably 1986. That really dates me. Long before there was an esthetician license here in the state of California. Back in those days, we were all cosmeticians, and then grandfathered in 1990 with the induction of the esthetician license. I'm also a Sedesco diplomat. I don't know if anyone else here is a Sedesco. If you are, maybe put it in the chat. I think that's great. But if you're not, that's fine too. Sedesco is an international program. I taught the international program for a really, really long time here in San Francisco, California. And a lot of the classes that I give, the the curriculum is interwoven, or Sodexo is interwoven into some of those lesson plans, just because I taught it for such a long time. Teach all of the clinical aesthetics phase at Concepts Institute, and like Wendy said, I partner with Alexander's, and I teach a lot of the live classes in Burlingame, California. Wish I could go to Colorado, Wendy, and teach some live classes there with you too. But usually California keeps me pretty busy. I teach a lot of the on-demand classes. You can take classes live. You can take them, on Zoom. You can take them on demand. I also, of course, practice aesthetics, both in my own clinic, where I've had most of my clients for over 30 years now, if they're still with us. And I also work with a lot of the physicians, and I hire for the physicians too. So in the Bay Area, when, doctors or medical professionals need an esthetician, we're always really good at trying to help them find an esthetician that is right for them, make sure that it's a good match. A little bit about the program before we get into the questions and answers. Do you want me to go ahead, Wendy, and put up the PowerPoint?
I think that would be nice so they can kind of just see the overview. Obviously not going to go through the whole thing, but yeah, I think that would be great.
Okay, perfect. So I'll just give you just a quick, it is actually a 30-hour class. So I can't go through everything, of course, but I will just show you some of the things that we go over in the medical spa aesthetics course. So this is specifically the medical spa aesthetics course. The clinical phase of things is a little bit different. This class is about 30 plus hours. It's online on demand, so you can take it in your own time. I think you have like 3 months to complete it. And it really helps. And we have quite a few people in class right now. It's open to you 24/7 for 3 months once you enter the course. And here are some of the different sections that I cover. The course is led by me, but there is a lot of input by physicians. There are really great interviews, demonstrations, like demonstrations on lasers and neuromodulators like Botox, fillers, uh, RF microneedling, all kinds of things. It's really chocked full of great information. So if you're really wanting to work in a medical spa and you want to have a really good idea of how an esthetician can work in conjunction with physicians, RNs, nurse practitioners, PAs, all of those wonderful providers while working within your scope of practice, this might be the class for you. So in section one, we go over the difference between traditional aesthetics and medical aesthetics and what that means. And of course, you can ask me some questions later about this. I'll just go over the sections right now. Section two, we go over an esthetician's role in the medical aesthetics office. And depending upon which state you're in, that can mean different things. Like in some states, obviously, even currently, an esthetician within your scope of practice, even not working in a medical office, may be able to provide lasers to your clients. In the state of California, they can't. So it's really different depending upon the states. Section three, we go over the difference between license. Of course, everyone has to have a license in the United States before practicing aesthetics. We go over the difference between license, certification, and what a certificate program is. This is a certificate program. So this is very similar to like a diploma. One would need their license first in the United States before they can practice at all. And then if you receive a certificate like the medical spa aesthetic certificate, we find it's been really, really helpful at getting a job in the medical office. And even more important, just really knowing what it takes to work, very nicely and smoothly in a medical aesthetics office. Section four, we go over skin science. And that includes the integumentary system. Of course, we all have to know and take a deep dive into that. Understanding the Fitzpatrick and Rubens classification, understanding anti-aging. We really take a deep dive into anti-aging, not just how the epidermis ages, but the dermis, what happens to the subcutaneous tissue, what happens to the muscle structure, and what we can do about that in medical aesthetics to improve that and really help to slow down the hands of time. We go over understanding melanin and the intricacies of hyperpigmentation, which is so important because when most patients come into a medical spa and you ask them, what are your top three goals? Almost always, it's either anti-aging or a combination of these three: anti-aging, anti-hyperpigmentation, and there's many different types of hyperpigmentation, and you can't just bucket them all and treat them all the same way. It's never one and done. And then, of course, it's either, acne or just having a more improved, smooth texture to the skin. Those are usually the top goals. We take a dive into acne and rosacea, facial muscles, Section 5, basic medical terminology, because if you're going to be charting, right, in a patient chart, you're going to need medical terminology. We go over skin scarring, wounds and healing, and how an esthetician can, work in the manner of helping wounds and healing, or how they would work with a physician. Section 7, the importance of understanding indications and contraindications before treatment and when to choose and what to choose. That's always important, right? As estheticians, we all have to deeply understand how to analyze the skin correctly. Otherwise, we're going to, pick the incorrect products and modalities. And then after that, structure a plan for the client. And it's never, right? It's never one and done. It's always a 6-month plan. Section 8, overview of the lymphatic system, and we do a little bit of lymphatic drainage. It's not the same as the clinical aesthetics phase of classes where it's, 7 or 8 hours of lymphatic drainage, but we do touch on lymphatic drainage in this class, or in this section rather. We go over lots of skin disorders, what you can treat, like pimples and comedones and things like that, and when it's time to refer to a physician. We go over skin cancer, cleaning, sanitation, disinfection, and sterilization, which is at a different level, right, in a medical office than maybe in a spa. We go over anatomy of a medical chart and patient charting, which is crucial. In an esthetician's office or a spa, it's a good idea, right? And it's something that you should do. But in a medical office, it's something that you have to do by law. You have to chart, and it's really important that you do it correctly and you follow HIPAA rules and regulations. We go over cosmetic lasers and light therapy, and I know a lot of estheticians in your state, you may not be able to practice this. This doesn't take you outside of your scope of practice, but it does give you knowledge so that if you're working with a nurse or you're working with a doctor and they need your assistance in some of these treatments, you can assist effectively. We go over neuromodulators like Botox. There's lots of neuromodulators. This is just one. You've probably heard of some of the others like Dysport, Xeomin, MyoBlock. We go over soft tissue fillers, body types, and popular body contouring and anti-aging. There's a lot here. This is 30 hours. Basic nutrition, common medications used and prescribed by a physician. We don't prescribe, but we need to know what medications are and what they do. The importance of taking before and after photos, which is essential in a medical aesthetics office. FDA designations and what they mean, medical aesthetic machine classifications, and then a glimpse at corrective skincare treatments estheticians can perform. So we do go over a little bit of microneedling and chemical peels and touch on things like just touch on hydrofacial. We don't really focus on the hydrofacial because the hydrofacial themselves trains in that modality. And then an interview with the medical aesthetics practice manager and what she looks for when hiring an esthetician, which is so important. We hear from quite a few doctors actually in this class. We hear from Dr. Green, who is a facial plastic surgeon. He also has some great demos in here like fillers and lasers and Botox. We hear from Dr. Romano, James Romano. He's a full body plastic surgeon, not just a facial plastic surgeon. We hear from Dr. Chris Bakke. She's a medical aesthetics doctor. She owns Marin Medical Aesthetics in the Bay Area. in California, and we also hear from quite a few others as well. So just a few more here, Wendy, and then I'll hand it back over to you. If you
Great.
do want to register or if you have any questions, you can always email us. If you do register prior to February 2026, there is an extra bonus for you. You also can choose one of the following classes. It's up to you. And these classes are about 6 or 7 hours. Now, the manual facial lymphatic drainage class has about 6 hours worth of lecture. Of course, this is in addition to the medical spa aesthetics course. About 6 hours worth of lecture. It comes with a very detailed demonstration video, and it's PowerPoint. The same with the LED light therapy. The same with treating hyperpigmentation and microneedling. And understanding cosmetic ingredients doesn't come with a demo video, but that is a really heavily based class, understanding all the most popular ingredients out there today and how they affect the skin physiologically. I always say an esthetician that doesn't know how to properly analyze is almost like a doctor that doesn't know how to properly diagnose. And if we don't understand ingredients, it's like a doctor that doesn't understand their medication. It's really important to have a good understanding. Oh, I wanted to add another thing to this list that I forgot, Wendy. It's the integumentary system, advanced skin analysis. That should also be part of this list. If anyone wants to jump into the class and you would like to take as your bonus the integumentary system advanced skin analysis, we'll add that to this list as well.
Great. Thank you, Michelle. That is very comprehensive.
Oh,
So
go
thank you.
ahead.
Yeah, it's great. So let me start with a couple questions that we had about this. Can you tell us your like intention, like why you thought it was important to create a class like this? Because being a medical esthetician doesn't really require like an extra certification, right? So what was your intention behind creating a class like this?
Yes, so back in the 80s when I started, there was aesthetics, right? What we do. There were spas and there was medical, mostly plastic surgery and dermatology, but there wasn't that bridge between them. When I started, there was no such thing as a medical aesthetics spa or a medical spa at all. No one had a medical spa. So back in those days, I did work in dermatology and also with a plastic surgeon and really became familiar with the field of medical aesthetics, if you will. That's the term for it today. And was asked by both estheticians and doctors to create, because I had taught for such a long time, going back to the early 90s. So, like I mentioned before, I worked as a Sedesco teacher, which is an international program, which is hundreds and hundreds of hours, and a lot of that is medical based. So in 19, no, not 19, sorry, in 2008, I created a Concepts Institute, which really helped to bridge the gap between medicine and aesthetics. And I feel helped make it a lot easier for estheticians to really have an understanding of how to work in a medical office. Or even if you don't want to work in a medical office, it's still important today, even if you're working as a solo esthetician, to be able to explain things to your clients like, Botox and what it does and, fillers, because some of these things, or most of these things, they're going to go to you for, and they're going to ask you questions, and they're going to ask your opinion and advice. So that is the reason why I, created the program overall, and just recently added in this new medical aesthetics spa course. Oh, one thing I did want to mention
Mm-hmm.
in the United States, there really isn't we know, right, a medical spa or a medical esthetician license. And I
Mm-hmm.
know that the NCEA and other, even the state board
Mm-hmm.
doesn't like estheticians to call themselves a medical esthetician. So
Mm-hmm.
generally what we do is we have the estheticians, once they become certified, on their, on their business card or website or whatnot, write in esthetician with a certificate, right, or certified in clinical aesthetics or in medical spa aesthetics.
Mm-hmm. Okay. That answers my question because I was going to ask what the difference is between license and certification, but I think you kind of, answered that. Do you need a certificate in the state of California to say you're a medical esthetician? Or is that more
You
on the esthetician to just be knowledge, get the certificate to be knowledgeable?
That's a really good question. And in most states, it's my understanding you don't need for your state board to have, I mean, in some states do. We, by the way, are certified through the NCEA, if you're familiar with the NCEA,
Mm-hmm.
National Coalition of Estheticians. So
Mm-hmm.
our medical spa aesthetics course is worth 10 continuing education units. So if you're an
Mm.
esthetician who needs continuing education units, we don't here in California, but if you do in your state, this is worth 10. So if you are NCEA certified, right, you do
Mm-hmm.
need continuing education units. And some state boards also recognize our CEs as well. But most states, because there isn't a license in medical esthetician, you don't really need by law to have a certificate. It's like having, well, extra knowledge, right? An extra credential, something that you can put on your resume, you can, have on your wall, show to your clients so that they'll have more confidence in you and you'll feel more confident and be more competent. But as far as the law is concerned, you don't have to have a certificate to practice a lot of what we teach.
Mm-hmm.
However, you definitely want to find out from your state board because
Mm-hmm.
I know here in California estheticians are not supposed to perform microneedling, but then you
Mm-hmm.
go across the border and
Mm-hmm.
to another state and you can. So it
Mm-hmm.
really helps to expand your knowledge and take you to
Mm-hmm.
the outer limits of your
Mm-hmm.
scope of practice. So instead of practicing in here, you're practicing out here, but still within your scope of practice.
Right. Okay, great. So just in terms of like a day in the life of a medical esthetician, what are some of the common duties of an esthetician in a medical spa, and how is traditional aesthetics different kind of from the medical aesthetics? How would that day be different?
Yeah, so, and I'm sure everyone here practices, or you're going to be practicing soon if you're still in school. But an esthetician in a traditional spa, of course, does facials, right? And you can do a lot of corrective skincare these days as well, especially if you gain the education and knowledge. But then there's also other things involved. You may do waxing, you may do eyebrows or lash tinting and brow tinting, which falls more under the umbrella of traditional aesthetics.
Mm-hmm.
Usually in the medical office, you don't. Now, having
Mm-hmm.
said that, some medical offices may have you do brow tints or brow wax, but that's very unusual.
Mm-hmm.
Oh, let me go ahead and mute that for you, Wendy.
Oh, can you hear the background? I'm sorry. We have.
Sorry. Oh, no, I'm sorry. I didn't know that was coming from your background. Sorry. No problem. Um, As a certified or an esthetician who has a certificate in medical spa aesthetics, you would probably, if you're working in a medical office, do facials, chemical peels, maybe even some of the more aggressive chemical peels. You may be performing microneedling. You would definitely be doing analysis of the skin. Um, the esthetician is always the champion of skincare in any office above anybody else. And so, what I find with my estheticians out there in medical offices is that when the doctor or the nurse or the MA or anyone has a question about skincare, they'll come to you. So you'll be doing probably more focused corrective treatments and also possibly be assisting some of the other folks, right? Some of the other providers in whatever they're doing.
Okay, excellent. Some of you joined a little bit after we did the intro, so I just want to reinforce it in the chat. If you have questions, please start typing away and asking some questions. I have a few for Michelle, but I want it to come from you guys who are the estheticians. So go ahead and put some questions into the chat. Michelle, as a medical esthetician, will the esthetician need to work under a medical doctor or provider, and how does that work?
That's a great question. So a medical spa is generally considered in most states a medical office. So in most states, a physician will own a medical spa. There are some states that a nurse practitioner can solely own a medical spa. You would probably need to check with the medical board of your state. All the states are different. I know in California, to own a medical spa, a physician needs to own the medical side of things by 51%. And then the other 49% can be owned by a nurse or a nurse practitioner. And that side will also do more of the management. So estheticians would be working under generally a medical director. The medical director would be at the very top. Now, that might not be your direct, boss. There are plenty of people to work with in a medical aesthetic spa. You have the manager, it might be a nurse, but generally they need to be owned by a physician or a nurse practitioner in some states.
Great,
Sorry.
thank you. Jordan asked a question. Is a medical certificate required to apply for jobs at med spas?
A medical spa aesthetic certificate is not required by law. But having said that, there are a lot of medical spas. Like currently, trying to hire an esthetician. So if anyone is in the Marin County, California area, let me know if you're looking for a job. But it's not required to work in a medical aesthetics office, but often the doctor or whoever's in charge of hiring likes to see that. Of course, the more experience, right? There's no substitute for experience. The more education, certifications, the better. And then, of course, it boils down to the person that they're hiring, how you relate to the office, and also your skills. But long story short, it's not required by law. By law.
Okay, great. Good question, Jordan. Are there any requirements to do like charting documentation or complying to HIPAA compliance since it could be in like a medical setting?
Yes, so HIPAA, the Health Insurance Portability and Accountability Act, that law that was implemented, I think, in 1996, governs all of the medical offices. So there's a certain way that you need to chart in your patient's chart. There's certain things you can't do, like you can't write something and then erase it. Or if you need to change it, you have to sign it. So if you're working in a medical aesthetics office, we do teach you that. I do teach you that in this class. If you're working with a physician or a nurse, hopefully they'll train you as well the way that they want things done. But yes, you definitely have to comply with HIPAA when you're working in a medical office, any medical office, not just medical aesthetics.
Okay, great. Um, in terms of long-term earning potential, does this role traditionally increase long-term earning potential for estheticians?
I find that it does. It really depends on the office and where you're working. So it gives you, of course, you'll have more skills if you're working there, whether you're trained by the staff if they're willing to do that, or you get the medical spa aesthetics training. But any education that you get, right, and you add that to your resume, and then you have that sort of for negotiation. I do find that a lot of the estheticians come back and tell me, yes, they do get a higher salary. And a lot of them are really kind of surprised that they actually receive tips in a medical spa. I even have sometimes the nurses tell me, well, the estheticians, they receive their salary and they get tips, and we don't get tips. So that really drives up your rate are the tips. People just find it interesting, oh, really, you're going to get a tip in a medical office? But yeah, the medical offices that I've worked in, not the plastic surgeon's office, that was a little bit different. But the medical spas, they accept tips for their estheticians. Now, having said that, maybe not everyone does, but every place I've ever worked or worked with.
Okay, excellent. Um, are there access to like sometimes we hear in the industry like medical grade skincare versus non-medical grade skincare? Like, how does that typically work in a med spa? Do they have different access to different products or?
Yes, so a medicine, generally products are called medicines, depending upon what they have in them. So something like tretinoin, right? We call it Retin-A, whether it's 0.25 or zero point 0.5 or whatnot is considered a medicine. So that would be a medical grade product. And a lot of it depends on percentage. I know a lot of times that companies or even providers will say our medical aesthetics line, and some things in that line may be medical, maybe a medicine, and some won't be. So it really depends on the product line. I know Obagi because I use Obagi, I have to use Obagi when I'm in the medical office, is their tretinoin. A few of their products are actually medical grade, or FDA would consider them medical grade, but they call the whole line medical grade. So is it really medical grade, or is it just that the percentage is higher, that it's, a cleaner product? I don't know. Did I answer your
Yeah, and I think probably when you talk about ingredients, like you were saying, like it's really important. Maybe that will help differentiate too, you know, what.
Yes, because like we know there's so many retinols, right? I have
Hmm.
a line with retinol in it. There's so many products with retinol, and that's not really considered medical grade. There is medical grade and then there's cosmetic, but nowadays we as an industry considered also clinical grade. I don't really think that the FDA views it like that, but what that means to our industry is clinical grade, the percentage is usually higher. The product can be obviously more effective. Sometimes the product, depending upon what you're using it for, may be sterile, like if you're using it for microneedling. But as far as the FDA is concerned, they recognize medical and then cosmetic, at least today, as we speak.
Yeah, that's kind of how we hear about it too. So I was curious about that. Um, there's a lot of different ways to be an esthetician. Obviously, you can like a solo esthetician. We have a lot of solo estheticians that are our customers. Can you be a solo medical esthetician, or do you have to work in a med spa in order to be a medical esthetician?
Good question. So you can be a solo esthetician or an esthetician working in a spa or a med spa anywhere and gain the certificate for medical spa aesthetics. So when you take the class and you pass the test and you receive your certificate, it'll say medical spa aesthetics. So if you were to put that, let's say on your website or on a business card or whatnot, you would have your name and then it would say esthetician, certified in or certificate in medical spa aesthetics. So you can be receive your certificate in medical spa aesthetics as long as you're an esthetician, a cosmetologist, an RN, PA, nurse practitioner.
Okay, that's good. And in your course, do you offer like career sort of counseling, job placement, help the esthetician to like change up their resume? Do you offer those kind of things in the class as well so that they can change their tune from a traditional esthetician to a medical esthetician?
Yeah, so the medical spa aesthetics course, although it's online, definitely
Hmm.
gives you the opportunity to email in all your questions. So
Hmm.
yeah, while you're in class and you have questions, please feel free to email them all in. There is for deeper and more extensive mentoring and consulting, we do have another service for that. As far as placement, there's not because we're a smaller training facility. We don't have the people power to place everyone, but anytime a job does become available, especially this year, the admin does post it, so everyone has the opportunity to at least interview for it.
Okay, awesome. We did have a question. Denise is wondering if the test is similar to the state board test.
It's similar. It used to be that it wasn't. It used to be more essay based, but now it's multiple choice. And because a lot of it's done online, it makes it easier. So as soon as you're done, like when you order the class, if you order the class, it pops up in your dashboard and you have everything there. And when you're finished with all of the sections, then you can take the test. So it is multiple choice. I would say well, obviously based on the material that we give you, but it is similar to that. At least it's multiple choice, and I think they're like 75 questions in total. And once you pass the test, then it sends me a note so that we could prepare your certificate. I can sign it, and then the admin actually mails it out. Snail mails it out because you want to have the actual certificate.
Yeah, excellent. Annie asked a question, is this true to all states? Um, Maybe clarified, does she mean, Annie, if you mean, is this applicable? Is this certificate applicable in all states? Um,
Yeah,
I'm not sure.
so because it's not a license, it's
Hmm.
not a requirement. So as far as like the NCE I mentioned before, are this class in particular, most of the classes are worth 5 continuing education units. I think the ingredient is worth 6
Hmm.
through the NCEA. So if you are also certified through the NCEA, this is great to have. But as far as the state board recognizing it, it's a very different, each state is different. Like for instance, California doesn't recognize anything but the state license and also doesn't require any continuing education units. Still
Hmm.
having this certificate is like, it's an extra credential. It's like when
Hmm.
doctors go to take or nurses take extra classes, they want that extra credential and they want to be able to apply their knowledge for their patients. Let me ask you, Wendy, does Colorado require extra CEs?
No, Colorado actually does not, but a lot of states do because we partner with NAS and Pro around the country, and they also offer CE credits for most of the states we go to because they do require it. So we have a few other states that are represented here. I'm curious. I guess we have California and Colorado, but curious, we do have someone from Chicago. I'm wondering what Illinois is, if they require CE credits, if the person from Illinois would like to let us know. Um, okay, we have another question. Are all the classes available online or in person, or does it depend on the course?
Yes, so a lot of the classes I give live are in Burlingame at Alexander's, California. I have one coming up, I think it's next Monday. And I can't remember off the top of my head what that is. It might be dermaplaning. So we do have live classes, and the live classes, you get, of course, the lecture and the demos and all of that. And you practice, and all of the classes do come with a really good detailed demo video. That's the clinical portion of things. So it's a little bit different. The clinical phase of things is different than the medical spa aesthetics course. They're more individual classes. Like you can choose, to take just a microneedling class or just a lymphatic drainage class. Um, and now I've lost my train of thought. I'm sorry, what was the other?
Yeah, I think the question
Um,
was, are the classes available online or in person,
yes,
or does it depend on the course? So I think you answered it. The medical aesthetics class that we're talking about is all online, but you
yes, this is all this is what happens 12 years past menopause. You start to lose your memory. But yes, all of the medical spa is online on demand. So that can't be taken actually in person. The clinical phase of the classes is both. You can choose to go online on demand as a rental in your own time. You can take it on Zoom when it's held on Zoom, or you can take it live. You could even take classes as a private one-on-one course. I have a lot of, like, for instance, I have someone coming in, she from a distance and needs to kind of knock out 3 classes. So she's coming to the Sausalito, California studio, and we'll do 3 classes in one day. So there's lots of variations of how you can take the classes.
Oh, that's great. I didn't know you did the one-on-one. That's a good
Yeah,
option.
one-on-one too.
And who doesn't want to go to Sausalito, California?
Yeah, it's very beautiful there. It's a little
Oh my
vacation
God,
spot.
it
So if you're
really
coming
is
from vacation.
one of my favorite. Denise asked, how many times can you take the test?
You can take the medical spa aesthetics course test. You could take it as many times as you need. It does, I believe, change a little bit like, the state board test would, but you can take it as many times as you need. It's not like what is it? It's not like the bar, right, where you just have a certain amount, but you can continue to try, and I'm sure you'll pass it.
Okay, great. Are there any other questions? I'll keep monitoring the chat. What I'll do is I'll go ahead and show you where to find the class on our website. I will also put the link in to the chat, but also, just so you all know, I will send a recording of this webinar. Once we're done, I'll send it to everyone that registered with the links as well. So the link to the classes and all
And
of
the
that
and the
stuff.
PowerPoint too. I'm sorry, Wendy's. One other question I saw pop up.
Hmm.
The classes are self-paced.
Oh yeah, there
The
it is.
medical spa, yeah, the medical spa aesthetics course is actually, you have 3 months with it. The other individual classes, like I know, Wendy, you have on your, I think, website, our on-demand lymphatic drainage, and I think dermaplaning. Those, how many uh, days or weeks do you offer with that?
I think we
You,
had it set up for 8 weeks.
okay. Yes, but this in particular, the medical spa is 3 months. So you have 3 months to get through the 30 plus hours. And if you need more time, you can always email and we usually can extend it for you.
Okay, awesome. Thank you. I'm going to share my screen right now. And um, so on our website, this is Alexander's Aesthetics. If you go to education, there is a link to our partner classes. And again, I'm going to put the direct link in here. But in case you miss it, I just kind of wanted to show where you would find the medical aesthetics course is going to be under this partner course. We also do have upcoming classes and events. This is going to be our live classes that we have. And again, Michelle said that she has some classes coming up in the California office, so you want to check that out. We also have on-demand classes with her as well. We have dermaplaning and manual lymphatic drainage with her as well. So you can go ahead and view those there. But to get to the medical aesthetics class, we'll go to partner courses. And then you go ahead and click on learn more. And that is going to bring you directly to Michelle's website for the medical spa aesthetics course. So I will go ahead and include this link in the Zoom. But I will also send it out after as well. So let's just stop that share and see if there's any new questions.
Yes, and
Um,
questions are good. Feel free to ask anything that you need to. I'm happy to answer any question.
oh yes, and I did just send the link for the medical spa um, class. Michelle, can you explain how it's going to work if they register for the class? How it will work with the free classes the options to get the free classes.
Yes, so once you register for the medical spa aesthetics course, that sends us over well, you'll get a welcome letter, and then you'll be able to access your dashboard, and everything will be on your dashboard. But anytime you have questions about anything, you can always email me since I will be your instructor. But I do get an email. So as soon as that comes through, I will then send you an email and just confirm, and then have our admin send you your class of choice. So the classes that you saw, maybe, if you want me to put them back up again, I can. But the classes that you saw, including, what was it, Wendy, we added? The,
Augment something in
oh
augmentations.
yeah,
What was I don't the right word? Augment. I
yes,
don't know if that's
the integumentary system class.
that's
So
it. Yeah.
yeah, let's take a look at it again. So if you register for the medical spa aesthetics course, which is its own thing, prior to February 15th, there's a bonus. So you can pick one of these classes, and you can also include in the choices the integumentary system advanced skin analysis, which takes a super deep dive into the skin and the functions of the skin and some, conditions and disorders and products and all kinds of good things. So you could choose that one, or you can choose one of these here that you see. And and again, I will email you as soon as you sign up. You can also email. You'll get the email that pops up that says, Michelle Phelan's your instructor. Here's her email. You could also just email me and introduce yourself. I'll probably introduce myself first, but you can still introduce yourself, and then that way we can also put in your dashboard, your Thinkific, platform dashboard, whichever class here that you choose. These classes here that you're looking at are about like 7 hours each, 7 to 8 hours each. And with the exception of the cosmetic ingredients, all the other classes come with a really good detailed demo, and you'll be able to keep the demo so that you can practice with the demo. And it comes with the PowerPoint too.
Okay, great.
Any other
Yeah, there are a couple more questions. Are
questions?
there any payment plan options for the course, or does it need to be paid in full when registering?
I think our admin, Pam, told me you can, when you go in and you click into register, I think it brings you to a page where you have things like, oh, I don't remember the name. I might be wrong, but like Afterpay or, pay, you have, what is it, 6 weeks or something to pay? It's broken down into payments. Is there another one called Klarna? Am I just imagining it?
Yeah, there is. Klarna is a payment plan option.
I think there's some payment plan
Okay.
options with the, yeah, with the,
Okay.
and there may even be some payment plan options for you through PayPal, because I know that they offer that as well. And I think that's one of the choices you can make. But if you do have questions about that, you can always, email us.
Okay, great. Are there any additional hidden fees that aren't talked about?
No, no, no hidden fees with us, never. So
Okay.
it's always what you see is what you get. We try to over deliver and under promise. So people usually get a lot more than they think they're going to get, because it's always better, right? Even with your patients or clients, to over deliver and under promise than the opposite way.
Mm-hmm. Right. Okay, and the last question we have here is how much are the classes?
Okay, so the medical spa aesthetics course is the one that's 30 hours
Mm-hmm.
is 499.
Okay,
That's what the one we're going over right here today, the 30 hours. And then if like we mentioned, if you sign on before February 15th, then you get an additional one of these additional classes for free.
great. And those are free, yes. All right, fantastic.
Any other
Well, any
questions?
other questions? I'm gonna pop back up let me pop back up the website just so everyone can see again where to get that. And if there aren't any other questions, I guess there is one more question, which is great. Which class has the best benefits in your opinion?
The classes,
I
the
think the free classes, maybe.
Oh, okay. It really depends on your want and need. So
Mm-hmm.
I have some people, it's still in school and they really want to know ingredients, and that's a super, super popular class, actually, cosmetic ingredients. They all are. I have others, who are just getting into LED and wanting to introduce that to their patients. So they're all important and they're all very detailed and they're all really science-based. It's hard for me to say. I think really the most popular, try to remember which ones I have up there, are lymphatic drainage,
Mm-hmm.
probably ingredients. Treating hyperpigmentation is so important. Remember, I told you that's one of the top three goals that any client or patient has when they come in. And there's so many different types of hyperpigmentation, right? There's solar lentigo, there's melasma, PIH, and you can't just throw it all in one bucket and treat it all the same way. So that class is really important if it is going to be your goal to treat it effectively, hyperpigmentation.
Okay.
I know I didn't answer that. So, it's hard to pick.
Yes. Question, the free bonus classes are available on the Concepts Institute of Advanced Aesthetics website.
The classes are all the on-demand classes, not just those, but all of them. They're like 15. There's acne, there's all kinds of classes, gua sha, there's so many classes. They are available for purchase on the Concepts website, yes. But if you were to, also rent, right, purchase this class, you'll get one of those that you saw for no charge.
Okay, awesome. Okay, she says that makes sense. Thank you so much.
Yeah, any other
Um,
questions?
yeah, I don't see anything at the moment. Michelle, thank you so much. It sounds like such an interesting class and really important to have in, to have that extra knowledge. Like you said, it's more of a credential than it is a required certificate, but very, very important. Denise says she really appreciated the information. So I think it was important to have this discussion before people sign up for a class. We know paying $4.99 for a class isn't an easy thing. So although very, very worth it, but it's great to get, those specific questions answered. So
Yes, absolutely. And if you have any questions, anyone, you could always email us, right?
yes,
Right, Wendy?
absolutely.
Yeah.
Yeah. And I'm going to go ahead and I will send an email and you can always respond to that as well, or just contact one of our offices. We have Alexander's Aesthetics is in California and also in Colorado. And if we can't answer the question, Michelle is so great and easy to get in touch with, so we can have her answered as well. We do have a quick survey. It's only 9 questions. So when I end this, if you can just stay online, we actually do review the results and we really want to make sure our webinars are full of, good information that you can take away, like tangible information you can take away with you. So any feedback is very helpful for us. I hope you all have a beautiful Monday and hope to see some of you in the medical aesthetics class.
Thank you, everyone. If you have questions, just email us. And thank you so much for attending this morning. I hope everyone has a great Monday.
All right. Thank you all. Thanks,
Thank
Michelle.
you. Thanks, Wendy. See you
Okay.
again.
Bye-bye.
Bye-bye.